essential to life. It is what gives the body oxygen and nutrients. According to the American Red Cross, an estimated 6.8 million people donate blood every year, and every 2 seconds, someone in the US needs blood. In the process of blood donation comes many factors, including eligibility and blood type. It is also important to know the journey the blood sample takes from the donor to the hospital. According to One Blood and American Red Cross, this journey can be seen in a 6 to 8 step process. I, like many people, did not know the many steps of blood donation until I started working in the laboratory environment. So have you ever thought about what happens to your blood after you donate it? Well, that's what I'm going to discuss with you, is that journey. To begin, we need to know who is eligible to donate blood. When a person wants to donate blood, there are certain criteria that need to be met to determine the eligibility. There are certain strict criteria, because this is to ensure the safety of the donor and the recipient. Some basic requirements are being 16 and older. 16 and 17-year-olds do need permission from parent or guardian to get their blood drawn, and you have to weigh at least 110 pounds and be in good general health. According to Carolyn Gard in her article, How to Give the Gift of Life, she discusses, when you decide to give blood, you will fill out a form about your general health. You are asked some confidential questions about your sexual health, HIV/AIDS, and intravenous drug use. So there are the basic requirements that will need to be met. Now, to discuss some common reasons people cannot donate blood is if you have been sick with the cold or the flu, for example, if you are pregnant, or if you have low iron, also called anemia. Additionally, if you have gotten a tattoo or a piercing or have traveled outside of the country, this affects your eligibility for about 3 months. Once eligibility is determined, we can move on to blood type. So how many people know their blood type? Blood type is determined in the processing part of the blood journey. There are 8 common blood types that are inherited from your parents that are known as universal donors. Universal donors are included in the ABO blood group. In the ABO blood group, you have A plus and minus, B plus and minus, O plus and minus, and AB plus and minus. So what is a universal donor? It's a person that has an O group blood type which can donate to any recipient of the ABO blood group. So according to the American Red Cross, type O negative and O positive, these two, are high in demand. Only 7% of the people are O negative. However, the need for O negative blood is highest because it is used most often during emergencies. The need for O plus is high because it is the most frequently occurring blood type in the population, with over 37%. Now that we have covered some background on eligibility and blood type, let's discuss the journey. Depending on the site you search, this can be seen in a 6 to 8 step process. So this image actually depicts the process in an 8-step process from the donor to the hospital. According to American Red Cross, the process includes donation, processing, testing, storage, distribution, and transfusion. The first step is donation. Included with what we discussed a little while ago with regards to eligibility, along with that includes the collection process when the patient is drawn. Second is the processing of the blood. The samples are received, spun in centrifuges, and each unit of blood is packaged into a separate component. This can include red blood cells, platelets, and plasma. The third step is done alongside with the processing step, where the samples are then tested for blood type and diseases. If a sample does test positive for a test on a disease, it is discarded, and this is to ensure the safety of the recipient. or whoever is getting the blood. The fourth step is storage. According to the component, they are stored in different temperatures. Red blood cells are stored in refrigerators, platelets are stored at room temperature, and plasma is frozen. Step 5 is the distribution, where the samples will be shipped to the hospitals and clinics from the storage facilities. Lastly, step 6, the transfusion step. According to American Red Cross, blood transfusions are given to patients in a wide variety of circumstances, including serious injuries, for example, when someone gets into a car crash, surgeries, childbirth, anemia, blood disorders, cancer treatments, and so much more. To conclude, the overall process of blood donation may seem simple on the surface, but it includes detailed steps to ensure the safety of the donor and the recipient. As discussed, the eligibility, blood type, and the journey from the donor to the hospital are important in this process. Now that you know the process it takes and how many lives can be saved, I hope you will think about these steps when someone you know is donating blood or someone is on the receiving end of a transfusion.